Ozempic, a medication primarily used for managing type 2 diabetes and weight loss, has recently gained attention for its potential to curb alcohol cravings. While this effect might seem promising to some, it raises significant concerns when viewed through the lens of addiction treatment and the complexities of substance dependency. One of the main concerns is the potential disruption of established addiction recovery programs. Alcohol use disorder, AUD, is a multifaceted condition that requires careful management, typically involving counseling, support groups, and behavioral therapies. By addressing only the physical cravings, Ozempic may offer a short-term solution without addressing the psychological and emotional components that drive addiction. This could lead individuals to believe they are cured or that the medication alone is sufficient, potentially bypassing critical therapeutic interventions that address the root causes of their dependency. Another issue is the lack of long-term studies on how Ozempic interacts with the brain's reward system, particularly in people with a history of addiction. Alcohol dependence is rooted in neurobiology, and substances like alcohol can alter the brain's pleasure and reward pathways. If Ozempic interferes with the system, there could be unintended consequences, such as triggering a rebound effect once the medication is stopped or the body adjusts to its presence. This is a crucial point of concern because addiction is not just about cravings. It involves deeply ingrained habits and a need for comprehensive treatment that goes beyond merely alleviating physical urges. Additionally, while Ozempic might reduce alcohol cravings, it does not directly address the social, emotional, and environmental factors that contribute to alcohol abuse. Individuals might still find themselves in situations where they are exposed to triggers, like social gatherings or stress, that fuel their alcohol use. The medication, therefore, could create a false sense of security, leading people to overlook the need for other forms of support that are necessary for maintaining sobriety over the long term. The potential for misuse is also a worry. Individuals who are already struggling with addiction might see Ozempic as a shortcut to controlling their cravings, but this medication is not designed for addiction treatment. By relying on it, people could delay seeking more effective, evidence-based therapies, such as cognitive behavioral therapy or medical detoxification programs, which have a proven track record in addiction recovery. Finally, there is the broader question of whether the medical community is prepared to handle the ethical implications of prescribing a drug like Ozempic for alcohol cravings. Doctors must ensure that patients receive a full and informed understanding of what the medication can and cannot do. Without this, patients might find themselves relying on a pharmaceutical crutch without realizing the full scope of what is required for sustained recovery from alcohol dependence. In conclusion, while Ozempic's ability to curb alcohol cravings might seem like a breakthrough, it is important to approach its use with caution, especially in the context of addiction treatment. It should not be seen as a substitute for comprehensive addiction care, and more research is needed to fully understand its long-term effects on both the brain and behavior. Until then, individuals struggling with alcohol dependence should continue to seek the guidance of addiction specialists to ensure they are addressing all aspects of their condition, rather than relying on a medication that only targets one piece of the puzzle.